Thank you to all our witnesses. We appreciate your testimony, and greetings to Mr. Prisolak. And thank you, by the way, for your efforts on behalf of the DISH payments, the disproportionate hospital share payments that are so important to a lot of our providers out there. I'd like to ask a question to Mr. Potter. Mr. Potter, you did an excellent job of trying to set the landscape out there for us of what we currently have and why it's so important to reform our system. But let me ask you this. Just as no mom and pop starts up a business to go bankrupt, just as no retailer tries to market a product that people who can't afford it will shop for it, an insurance industry company gets into business to offer insurance. The way you make money with insurance is you reduce your risk. You try to reduce your risk by seeking out customers who offer the least amount of risk. If you're going to be a health insurer, that means you're going to try to insure people who are healthy, wealthy, or young. Because if you try to insure someone who's sick, chances are you're going to have to provide them with benefits, benefits to their insurance. If they're poor, chances are they can't pay, so the insurance company will have to provide more of the payment. And if they're older, they're likelier to be using more of our health care resources. So you can't blame an insurance company for wanting to seek out the healthiest, the wealthiest, and the youngest. We can try to make it so that they'll try to compete for the business of every American, whether you're healthy or not, whether you're rich or not, or whether you're young or not. And so when you mention the public option as a choice, I'm wondering if perhaps what the public option does in a system where we rely on insurance to give Americans access to health care, that what we're really saying is we want insurance companies to be profitable. Many of us are invested in insurance companies, but we want them to also to do a public good, and that is to go to everyone. But to have them go to everyone, you have to give them an incentive.
I need the gentleman's question.
So thank you, Madam Chair. So my question would be this. Would the public option be a way to help make the private insurance industry truly compete for all business, not just the business of the richest, the wealthiest, and the youngest?
Yes, Congressman, I think it would. Right now you have a situation, particularly for the for-profit companies, which now truly do dominate the industry. 1 of every 3 Americans is enrolled in a benefit plan offered by just 7 of the largest companies. They do look first to the needs of shareholders, and you're exactly right. They try all they can to avoid risk. In fact, you'll be hard-pressed to find the word insurance on the websites of these companies. They typically now call themselves health benefits companies or something like that. And a public option would go a long way toward providing some balance to the demands of Wall Street. And if they are required to take all comers, as I hope the legislation will finally force them to do, a public option would indeed hold them more accountable and serve as a benchmark and help to set some of the rules of the road. I think it would go a long way toward doing that.
Thank you.